Hello, my name is Olivia Garsantin, and I'm going to talk about my paper on mixed method analysis of monitoring data based on a user-centered design perspective. We all know that there is a big gap on the building performance, both in terms of energy use and indoor environmental quality. And we also know that a very big part of that gap is caused by the occupants of the buildings. This figure tries to summarize what are the ways in which people actually affect the performance of buildings. This is both before and after the delivery of the building, and also has an influence on the actual energy consumption of the building, but also on the theoretical performance, which has more of an effect on the decisions taken regarding the use of low carbon technologies in buildings or renovations. So these challenges, for example, the rebound effect that is very well known, but also the complexity on the relationship between people and technology, etc., those could be solved by using monitoring data, and they're already used. For example, we know that by having more accurate building simulations and energy calculation when we are going to do a renovation of a building, we can be more certain of what are going to be the energy savings that we're going to have, and so we can decide better what type of technology to apply in those buildings. So we're tackling here the rebound effect. And we also have, for example, serious games that aim at increasing the understanding of people on how their actions in the building affect the environment. So tackling the rebound effect. In this paper, we're focusing on this part in which we want to take into account the needs and preferences of people in the design of the building, so we can provide better environments for them, but also reduce energy use. So in this paper, we used what we call the mixed method analysis, in which we use both quantitative analysis of monitoring building data, and we combine that with qualitative analysis of of the post-occupancy monitoring, for example, interviews, surveys, and walkthroughs with people. The idea is to understand better what are the user practices and their behavior, so we can have better information when we do design choices. So we're focusing here on obtaining from this monitoring data what are the actual needs and preferences of people, what are their occupancy practices, what do they do at home or in different buildings, and what are the drivers for their behavior, why do they do what they do. And we did this methodology on this building, which is a care home in the UK. It's passive house, and the special thing is that it specializes on dementia. And this building was already monitored a few years ago, but we had a lot of both quantitative and qualitative data, so we wanted to apply this method to it. And something special about this is that the designers that made this building, the builders, they were specialized on dementia care and care homes, so they knew very well the target group. So even when they wanted to experiment with passive house, they also wanted to make sure that they had a backup plan. So they added radiators in all the bedrooms, and they added air conditioning in the common areas, and all windows in the building were openable the whole year. The building was monitored for a whole year, and with the data that we collected from the building and from the people living and working in the building, we were able to determine what were the occupancy practices followed in the building, mostly by the staff, what were the user preferences of the residents in terms of thermal comfort and air quality, and the differences between people, and how these were affecting the energy performance. First of all, we wanted to know what were the comfort levels in the building, and we used the predicted mean vote method, and also just a survey to know how people feel in the building. And then we also look at how the building was being operated to provide with the right levels of comfort to the residents. What we did with this data was to build up occupancy profiles for the different spaces and the different seasons in the building. We wanted to know in this way what were the differences on needs and preferences of people, of the residents in the building, looking at the indoor temperature, the ventilation profile, and also the use of radiators. And as you can see in the pictures, we found large differences in the different rooms. Now, because the building is fully controllable by the users throughout the year, so they can open the windows or use the heating and the air conditioning at any time, we are then assuming that the indoor conditions reflect the actual needs and preferences of the people. And this is also because the staff indicated that they always follow the needs of the people. They always ask for what do they want. However, that might be true for the healthy residents living in the building, but not for the people living with dementia, because they cannot always express their comfort. So the next step for us in this research is to know what is the relationship between the indoor conditions in the buildings and the actual health of people with dementia, how high temperatures or low temperatures affect the behavior of the people. And second, how can we monitor either in a better way the indoor conditions or this behavior that people with dementia show? And in that way, we can use data-driven solutions to provide better environments to the people and also to give better information to the staff, to the care staff of buildings on what is the health status of the people. So this is the end of my presentation. Thank you very much for listening.